All right, welcome in everyone. Ready for another deep dive.
Definitely always ready to dig into some interesting stuff.
Today, we're going to be looking at something that affects pretty much everyone who uses mental health services, insurance.
The world of billing and coding and all those fun regulations.
Exactly. And, we've got some great source material to work with here. This document called Insurance Related Matters, which, let me tell you, gets into some of the nitty gritty.
I bet.
But, I think this is so important for everyone to understand, like, even if you're not a therapist or a counselor,
Totally agree.
because knowing how this stuff works on the back end can really help you advocate for yourself and understand your rights as a patient or a client.
Absolutely. It's about that transparency and understanding the system better.
Right, and you might be surprised by some of the rules around things you might think are pretty simple. Like, did you know that routinely waiving copays could actually be illegal in some cases?
It's true. It can definitely get tricky. There's this whole web of legal and ethical considerations that providers have to navigate.
Yeah, unpack that a little bit.
Okay, so first off, we got to acknowledge the big one: insurance fraud. It's straight up illegal. And we're not just talking about some vague concept here. The California Insurance Code, like that's the law, right? It lays out very specific rules about what constitutes fraud, and the consequences can be pretty
No
serious.
kidding, so we're not messing around here.
Not at all. And then you've got things like the Business and Professions Code, Section 2960N.
Okay, now we're getting into the alphabet soup.
I know, right? But this one is important because it specifically calls out insurance fraud as unprofessional conduct. And for licensed professionals like therapists, that can mean disciplinary action, even potentially losing their license.
So it's not just about, doing the right thing. It's about protecting your whole career.
Exactly. And then on the ethical side, like beyond the legal stuff, there are ethical guidelines that psychologists are expected to follow. And there's one in particular, Ethics Code Standard 6.06, that really hits on this idea of accurate reporting.
So what does that mean, accurate reporting,
Sure.
in this context?
It basically means that psychologists have to make sure that everything they report to insurance companies, like the nature of the service provided, the fees, all of that, it's got to be accurate. You can't be fudging the numbers or, trying to get creative with billing.
So no sneaky stuff.
No sneaky stuff. And this principle of accurate reporting, it really pops up all over the place when you look at these regulations.
Okay, so let's get into some real-world examples here. What are some common situations where these rules come into play? Like, give us the scenarios.
Okay, so like we mentioned before, waiving copays is a big one. A lot of people think, oh, I'll just waive the copay for this client. It's no big deal. It helps them out. But it's not that simple.
So why is that a problem? Like, what's the issue there?
Well, insurance companies use those copays to understand the actual cost of care. They factor those payments into their calculations for, things like premiums and reimbursement rates.
Makes sense. So if you're messing with the copays, you're messing with their whole system.
Exactly. And it can also be unfair to other clients who are paying their copays as expected. So, unless the insurance company specifically agrees to a copay waiver, it's best to just stick to the rules.
Got it. So waiving copays, not as easy as might seem.
Right. Now, another thing that comes up a lot is missed appointments. Clients sometimes just don't show up, and the question is, can a provider bill for that time?
Yeah, because it's time they could have been seeing someone else.
Exactly. But our source is very clear on this one. You can't bill for a missed appointment unless the insurance company has specifically agreed to that arrangement beforehand.
Interesting. So no surprise bills for no-shows unless it was cleared ahead of time.
Nope. Transparency is key here.
Okay, and then there's the whole world of diagnosis codes, which I think can be confusing for a lot of people.
Yeah, those codes can seem like a secret language.
Totally. So let's try to demystify them a little bit. What are they and why are they important?
So basically, diagnosis codes are a standardized way to tell the insurance company what the primary reason is that someone is seeking therapy.
Like a shorthand for the clinician to tell the insurance company what's going on.
Right. And these codes, they're not just for fun, they actually determine what services are covered by insurance.
Okay, so it's not just paperwork. It actually affects what people can get access to.
Absolutely. And like with everything else, accuracy is super important here.
So can you give an example of how those codes might work in a real situation?
Sure. Let's say you're doing family therapy, and one of the family members has a diagnosis that's covered by insurance. In that case, you can bill under their name even if you're seeing the whole family. But you can't, let's say, use a code for individual therapy if you actually provided a family session.
Ah, so the code has to match what actually happened in the room.
Exactly. The procedure code, which is the code that tells the insurance what type of service you provided, it has to be accurate and match the diagnosis code.
No, it's all starting to click into place now. I'm really getting it.
Right.
So, shifting gears a little bit, let's talk about what all of this means for the person receiving the services. Like, what should I, as a client, expect from my provider when it comes to insurance?
Well, first and foremost, your provider should be upfront with you about how insurance works. During that initial informed consent process, they should explain what information they're required to share with the insurance company and if there are any limitations on your treatment because of your insurance plan.
That makes sense because sometimes insurance companies only cover a certain number of sessions or certain types of therapy, right?
Exactly. And then, if your insurance company denies payment for a service that your provider thinks is medically necessary, your provider should be willing to fight for you. They should file an appeal on your behalf and try to get that decision overturned.
So they shouldn't just say, oh, well, insurance won't pay for it. Too bad.
No, they should be your advocate. And if the appeal doesn't go through, then they should have an honest conversation with you about other options. Maybe there are alternative treatments that are covered, or maybe you can work out a payment plan. The point is to work together to find a solution.
It's all about communication and collaboration.
Exactly.
Okay, so we can't talk about mental health services these days without talking about telehealth. It's become so huge. So are there specific rules about insurance coverage for telehealth?
You bet. There are now laws that require insurers to cover telehealth services, for things like diagnosis, consultation, or treatment, and they have to cover it at the same rate as they would for in-person services.
Which makes sense because it's still the same service, just delivered in a different way.
Exactly. And this is really important for making sure that people have access to care, no matter where they live or what their circumstances are.
Absolutely. Access is such a critical piece of this whole puzzle. So speaking of access, are there any regulations around wait times? Like how long someone has to wait to get an appointment?
Oh, yeah, for sure. There are laws that say health insurers have to offer you a non-urgent mental health appointment within 10 business days of when you request it.
10 business days. Okay.
Yeah, and that's just for the initial appointment. They also have to provide follow-up appointments within 10 business days, to make sure that people aren't falling through the cracks. And if they don't have enough providers in their network to meet those standards, then they might have to cover you to see someone out of network.
So they can't just say, sorry, we're booked solid, see you in 6 months.
Right. They have to make a good faith effort to get you in to see someone in a timely manner. And then on top of that, they have to ensure timely referrals to specialists. So if you need to see a psychiatrist or a psychologist who specializes in a certain area, they got to make sure that happens in a reasonable amount of time.
So there are a lot of safeguards in place to try to ensure that people can actually get the care they need.
That's the goal.
It sounds like the theme that keeps coming up here is transparency and accuracy.
Yeah, it really is. Those are the cornerstones of the whole system. And it's not just about following the letter of the law, it's about doing what's ethically right and building trust between providers, clients, and insurance companies.
And ultimately, it's about making sure that people can get the mental health care they need without having to jump through a million hoops.
Yeah, exactly.
So for everyone listening out there, the key takeaway here is that there are a lot of regulations in place to ensure that things are done ethically and that you have access to appropriate care. And knowing how this stuff works can really help you advocate for yourself.
And it brings up a really important question that I think we all need to think about. Healthcare is incredibly complex. There are so many moving parts. So how can we as individuals and as a society make sure that these regulations are actually understood and implemented in a way that creates a system that's fair and accessible for everyone?
I think that's a great question to leave our listeners with. We all have a role to play in making this system work better. Thanks for joining us for another deep dive.
Thanks for having me.